Hello, everyone. My name is Anita Iyer, and I run Ekansh Trust in Pune. We are an NGO that works to empower persons with disability, and we focus very clearly on prevention, detection, and early intervention in our work. Today, we are meeting with a developmental pediatrician, a very well-known, well-experienced developmental pediatrician, Leena Srivastava. Dr. Srivastava, thank you so much for joining us today. Um, uh, the first question that I will be asking you today is that you see patients, children with disabilities very often. So, what is the most common type of disability that you would say you see?
Good evening, Anita, and thank you for this, campaign that you're doing about awareness on early intervention, which I'm very passionate about. So, actually, when you say that I see children with disability, actually, probably I see them much earlier before a diagnosis of disability is made. I would probably be seeing them with developmental or behavioral concerns that could potentially evolve into a disability or could put them at risk for a disability. Probably presently in the last few years, I think the most common one that I would be seeing is children with features of autism spectrum disorder. More and more over the years, we're seeing them early, and many of them are still at risk for autism spectrum disorder before an actual diagnosis or a disability diagnosis is made. So these children, when they come to us early with concerns in the social communication domain, are the ones probably which I see most often, and then we offer them the early intervention protocols.
So, my second question is what do you believe is a leading cause of disability in infants and children? You were also talking about autism becoming more common now.
I wouldn't know statistically whether I'm right, but probably hearing impairment, you know, the increasing prevalence of autism spectrum disorder. Probably hearing impairment still I would emphasize as one of the leading causes of disability that can be easily prevented if picked up on time or identified on time. But I wouldn't know like exactly which is the leading cause, but then we have a lot of you have hearing impairments, you have autism spectrum disorder which is increasing, you have intellectual disability, etc., also which can be picked up early. But hearing impairment I would emphasize again is so easily identifiable at birth itself, and remediated early, it could give rise to very good results. So I think that would be on my priority list with many others actually.
Right. So, do all children get screened for disabilities as they are born? All babies, are they screened immediately?
You mean for hearing, or you mean generally for disabilities?
Generally, for different disabilities, are they typically, as soon as a baby is born, the first 1 or 2 days, do you think they are screened? And should they be screened at all? What is your advice?
So probably for congenital anomalies, some obvious structural and disabilities, definitely each and every child is screened when he's born in a hospital. Even hearing screening actually is being propagated as it should now be done universally. Earlier, it was advised for the high risk population or the NICU graduates. But now more and more, there have been protocols that advise that universal newborn hearing should be done since it is remediable. A routine developmental screening is advised by all guidelines at regular intervals in the first 2 years of life. And if done well, it could probably pick up a lot of early red flags that could potentially lead to delays or disabilities later. In fact, the government itself, the RBSK is now, the DEICs and the RBSK itself propagates that all deficiencies, defects, delays should be picked up early. So I think a lot has changed in the last decade, and we have a lot of guidelines in place now. Whether they are implemented everywhere or no, probably time will tell, because obviously it will take time in such a big country of ours to actually, have it implemented on ground level at every place. But yes, we do have guidelines for developmental screening and picking up delays early now.
I'm asking you this question specifically because, in our early intervention outreach, rather advocacy, we talk to Anganwadi workers, etc., and we tell them that a woman, as soon as she gets pregnant, should get herself registered at a health center and preferably deliver her baby in a hospital or a nursing home, so that she gets the guidance she needs and also the tests that she needs and the newborn baby also needs. So this is extremely helpful. Thank you. And what would you say early intervention is really, and what is its importance? And if caught early, would you say that the severity of a disability can be managed or reduced? Please elaborate.
Okay. So basically, when we're talking that every child should be screened for development at regular intervals, especially when they go for the immunization visits, a quick development screening is easily doable. Again, if you're working with the Anganwadis at the ground level, at field level itself, easy developmental screening tools are available which can screen these children. Now, when we pick up these developmental concerns, or even children coming to me usually come for developmental or behavioral concerns. So when we pick up these children early with some concerns, they may not yet be, already in a place where we want to diagnose them with a disorder. So many a times they would just come with concerns or frank delays, but still not amenable for a diagnosis. So at this point of time, or at any point of time when any child has concerns in development, there is early intervention practices, which actually means that there is a training or therapeutic intervention to teach the child new skills, or to improve their abilities. Okay, so that basically is early intervention. And in the first few years of life, when we know that the child will respond well to these training maneuvers, it is important that wherever we see a concern, in whichever domain of development it may be in gross motor development, where we may include the services of a physiotherapist to give these interventions. It may be in the fine motor or the sensory domains, where we may include an occupational therapist to give these interventions. It may be in the communication, where a speech and language pathologist may come into the picture. It may be, early academics in the preschoolers, where a special educator may come into it may be behavior, where a psychologist may come in for behavioral therapy. So basically, when we work with developmental and behavioral problems as a pediatrician, we do involve a whole team, and everybody is involved in this early intervention, which is basically a team process to teach the child the abilities that the child is weak in and try to improve him in those domains. Now, I think the second part of your question was, does this work? Oh, yes, it does. We have enough evidence. Means this is not just me saying it. We have enough evidence, we have enough science behind this, and we know now that early intervention works very well in many neurodevelopmental disorders, right? So as we said that something as simple as hearing impairment, if remediated early, can give us much better results. Then even like we know the high risk population, like neonates, especially who have had early turbulent phases or have had a NICU stay, etc. If we find that they are a high risk population for developmental problems later, they receive early stimulation and intervention, and definitely their outcomes are much better than if they wouldn't have. Then even like we were speaking about autism spectrum disorder. In fact, in autism spectrum disorder, evidence says that early intervention works. And many a times, if we find a child with social communication delays or deficit, and we find that the child is at risk for autism spectrum disorder, and you start appropriate early intervention, sometimes you may be able to even shift the child out of diagnosis, or the child may not fall into a diagnosis later. So the power of early intervention is undebated now, and we have enough evidence saying that it works.
So why is the 0 to 6 age group so important?
So basically, a 0 to 5 or 0 to 6, which we say is the period where early intervention is best worked on, is important because at this point of time, this period of time rather, the brain is amenable to change. It is more moldable, so to speak, right? So we talk about the concept of neuroplasticity, which is the basis of early intervention. So basically, if I talk in very simple language, the brain itself has lots of circuits, which are actually synapses, connections between the neuron synapses of the brain, right? In very simple words, they are circuits. With the child forms when he's playing any skill, or he's developing any skill, right? So the more we train the child in these skills, the circuits get formed and they become stronger and stronger if training in those skills are repeated and done regularly. The sad part of this is if the child is not stimulated well, or this early intervention training is not carried out regularly, the child may actually lose these circuits which form so early in life. So for the first 2 years or the first 5 years, we have like millions and trillions of synaptic connections being formed, but if they are not used, we may actually lose these connections, or these circuits are pruned, so to speak. So we will be losing, important brain material that we can use for the child to gain new skills. And that is the important period of 0 to 5 years where early intervention shows best results. Even later, you may have a little neuroplasticity of the brain, but that will be a much, slower, pace as we would achieve in the first few years of life.
In your years of experience, how do parents react to being told that their child has a disability? And what is your advice to parents who have learned that their child has a disability?
So basically, I think it is just like any other bad news, as humans, when we hear anything that is not what we expected, or not what we want to hear. We go through, denial, we go through anger, we bargain with God and with everybody around us, and we may go through a low phase, and then we finally accept any news that we do not like to hear. So parents of children also who have developmental problems, or who have received a diagnosis of a developmental disorder or disability, would obviously go through the same, because everybody wants the best for his own child. My advice to such parents would be that I would understand that, of course, it is difficult for a parent to know that the child may need long standing support, or may need a lot of intervention to optimize his development or his abilities. But the earlier we go through all these phases of denial, etc., and accept what is being told to us, we may ask questions, we may research, we may ask for literature to read through, we may meet parents of the same problem so that we can discuss our doubts. But the earlier we accept what is being told to us and start working on it positively, in a positive frame of mind, the better it is for them and for the child himself. Because as we just spoke about early intervention and the importance of the first few years, then what happens is, if you take a very long period to accept the news and start work, you are losing out very precious time from the child's life, where real good work needs to be done.
Yeah, very true. Is there any specific case regarding a child with a disability that stands out in your memory that you would like to share?
I think there may be so many. So while I can't pinpoint anyone, probably one strong mother does come to my mind, and she inspired me. Actually, a lot of them do. I think since I've started working in this field, that parents inspire me every day. They are so strong. So I think there was this mother who was absolutely illiterate, and the child had a bad neonatal course, and his MRI also showed us findings that showed us that the motor outcomes would probably be really poor. So while we do counsel them and then we tell them, let's start with early intervention, the mother did come to us quite early in the first year of the child's life. But she told me, in her native language, that I don't care what your MRI tells me, but I will work hard and my child will walk, and that is my promise to you. And believe it or not, with such a bad MRI, we all really worked hard. And I remember we usually celebrate every outcome of the child's course, but we really celebrated this child. He did walk independently, and it taught me that I wouldn't say miracles to happen, but it taught me the power of early intervention. And I think we should never underestimate the power of early intervention, because it has, early intervention has started in the last few decades. So we never know what results we can get. And I think since then I've become a bigger fighter and advocate, and I do push the parents a lot. But I think in every child's success, and there are quite a few, I think it is more than us, of course, as a guiding doctor, and so many of us others who, support these parents. It's mainly a caretaker who never gives up. And I think I salute them all.
Absolutely. A lot of parents of disabled children or children with disabilities worry about the quality of their child's life as they get older, and also the discrimination that they will face in society. What do you have to say about this, and how would you think they can, improve the quality of life of those children with disabilities?
So basically, I think that, as we said, first is acceptance. If you don't accept your child, you're going to be worried about taking the child out, about how society will react to your child, and what people will say. And I think if you accept your child for who he is, with his strengths and his weaknesses, then I think you shouldn't bother about what the world will say. I always tell them, तुम्हारे बच्चे को 85% की जगह 82 मिलेगा तो भी the world will say. I mean, the world will, they will, लोगों का काम है कहना. They are going to say things. You can't let that affect your relationship with your child. And for a child, I think it's most important what the caretakers say to him. Or, every time a child does something, he look up to the caretakers to see if they are encouraging him or they are happy. So I think accepting a child with his strengths, his weaknesses, having focused goals with evidence-based interventions in place about what realistic outcomes you are expecting for your child, and then working towards them. And of course, as I always say, I also want parents to selfishly try to take some time out for themselves as well, so that they remain happy and positive, and then they can have a much better and a positive interaction with their child as well. So it's not that just because you have a child with a developmental problem or a disability that that becomes a part of your life. Working towards those outcomes is a part of your life. You don't have to stop living life completely, whether it is with your child, whether it is playing with your child, whether it is going out on family outings, whether it is just enjoying yourself, whether it is taking time off for some yoga, meditation, or exercise yourself. Life goes on, and you have to just accept this as a part of your life's journey.
Is there any advice that you would like to give your medical fraternity when it comes to disabilities, when it comes to diagnosis, etc.? Are you happy with the, you spoke about a team in which you work, for example, you with the therapist, etc. Do we have enough such teams, even in a city like Pune? Do we have enough such teams, and what is the kind of motivation or suggestion that you would want to give groups like this to come together and work together? Because a lot of parents get lost in trying to find a physiotherapist and trying to find an occupational therapist, a speech therapist. Finding the different team members itself becomes an exercise, and then it becomes a big expense also for them. Not finding them and then engaging with them and making sure that the child gets therapy, it's all a huge, sometimes expensive exercise. What would be your recommendation?
So basically, I think one is early identification. Like whenever a parent comes to anybody, dealing with children and has a developmental concern, I would never let that go. I would always, even if I think at that point of time it is not a delay, maybe schedule a follow-up. Right? So always early identification, in the sense that a parent's concerns always prime for us, right? So we always take cognizance of the concerns, right? And always at least try to schedule follow-ups to see how the child develops ahead, right? Secondly, I would say that even though, teams of intervention may not be available everywhere or at every level, there are a lot of medical colleges where, good child development centers have come up. There are institutes where good child development centers have come up, which have everything under one roof. Though that is not possible everywhere, of course. So maybe more liaison between professionals working in this field, and a holistic monitoring of a child's development, that is actually a very important role. So whether it is a pediatrician specialized in developmental and behavioral pediatrics, whether it is a pediatrician in experience with child neurology, or in older children it may be a psychiatrist, but somebody actually monitoring the whole team, the intervention, the child's etiology, underlying disorder of the child, which is causing the delay, and monitoring the goals and sort of coordinating and guiding the family with the whole team is also a good idea, and it always gives better outcomes and makes it easier for the parents also and the families.
Thank you so much for all your answers, Dr. Leena, and thank you once again for joining us today. Thank you, Team Ekansh, for the back-end support, and thank you everybody who's watching this. If we have more questions, Dr. Leena, we are going to come back to you, because I'm sure that after watching this, people will have some questions to ask. And once again, thank you so much.
Thank you, Anita. Thank you, team.